Yeah,
Do you see my screen?
I can see it.
Okay. So a lot of times with the shoulder problem, you see this in like pictures, you see that almost anybody with the shoulder problem right here, let's just say you have the shoulder here, that's the issue. What a lot of times is we
Right.
have this dysfunction that goes on with the shoulder girdle, which as a result that affects the lat. And if you look at the lat, it actually has this
Mm,
like these lines or these striations that attach down to the lower back. So you have, you're having the same sided left shoulder pain.
yeah, it's on the same side. It's really tight.
So what can happen, there's two things that can happen. Well, one, depending on the individual, you can actually develop opposite side low back pain, like on this
Hmm.
side, believe it or not, because of what we call a fascial sling. So essentially, in the
Hmm.
back, we almost have like this X position, these X positions, which if we zoom out onto the body, it's actually really fascinating the way the fascial slings work. They're like this. And then then if they actually wrap around the front,
Okay, got
and they
it.
kind of, and so what those fascial slings, they're essentially there as like a stretch and allowing the body to move in the most efficient way possible. So what we will find is that somebody with shoulder pain may actually develop opposite side glute or hip problems
Okay.
or QL problems on this opposite side. If it
That
hasn't,
tight, that metal is tight too on my right. On
so if,
the, it's
so
not as bad. I've been rolling it.
so really the way to fix that is to address the dysfunction up through here, and you can do some foam rolling and some discomfort relief up through the mid back here, up through these areas
Okay.
first.
More than rolling on the foam roll, because I've been rolling that almost every day, that upper area.
Mm-hmm.
Um, but not like, but that's funny because I don't know where I was. I was standing next to like a wall and the muscle or I don't know, maybe it was my chair or something. The up and down my spine muscles, all up where you're saying, were so sore.
You
It
mean
was
like
almost like I
you mean
wanted to
down
like
here?
work them out. No, up, like right next to my spine,
Here?
up in the top. Yes, in there. Like, I don't know if you can't see,
Yeah.
I can't tell, point
Here,
down.
let me pull you up again on the. Okay, so I can see you. I don't. You can't see me, but I know what you're saying. So right through like these areas here. And what
Yeah,
you
but down a little bit. Yeah, like all in there and then down, like in there and there. Yeah.
okay? Yeah, I
Mm-hmm.
mean
See,
that
I feel the pain there, but when I started to roll in there, I was like, oh my God, like this is so tight.
all these
I'm like,
muscles that are usually tight and closer to the spine, these are the postural muscles
yes,
that really
yes.
need to be able to function properly. And if these muscles that help move and glide the shoulder blade and crisscross over each other not working, these ones are definitely going to work harder. So it's
Okay.
really more about
And that's
fixing.
affecting my,
It's really more about fixing
okay.
this area and soothing these other injuries. Now, a lot of people will, like, in my perspective, will say, well, just don't worry about this problem that you have in your QL or this area that you have in your low back, because if you fix this, you'll fix
Right.
that. I call complete BS on that, because if you're having a complaint, we know where the source of the problem is, but that doesn't mean we don't fix you and make you feel better in the symptoms. We
Right.
still have to
Okay.
address symptoms. Let's like I know a lot of chiros and a lot of PTs and doctors will say, well, what's the true cause? I'm like, yeah, well, you're not being sympathetic and actually taking care of the person. Then, like, pay
Right.
attention to the
Okay.
person. So for you, yeah, we should focus on the cause. You already kind of know what to do, but roll this out. Be a little bit more gentle with it. Release these. I can put
More on
some
the top, you
stuff
said? I can't see where you're pointing on the top.
up through here.
Roll it out more.
Say that again. I couldn't hear you.
All right. Where did I roll it out more? Up on the top, you're
You can
saying.
roll it out like just a foam roller right through the middle of the back and like open up your back to help that.
Okay.
And you can also
But
still hit
that
the muscles on each
to the
side.
ball. Do what?
You
Sorry.
can hit the muscles on both sides too.
Oh, like do it individually, like separate. That's a good idea.
Yeah, I would do that. And then of course the lower back and like you know, these muscles and the QL here. Let's get through here.
Should I roll it?
I can show you how to do it. Here's the QL here.
Okay. Yeah.
Obviously, we're talking about what this left side. So for you, you can see the QL here, and you can kind of hit that. It's in between the rib and the crest of the ilium. So if you kind of go to the back of your bone right there, and you're like, oh my gosh, that's the back of the bone, you go to the lowest part of the rib, and then you kind of bisect that middle. X marks the spot. That's where you want to kind of take that foam roller, go onto the side. And I think I have a video I can upload to you for that too.
Okay.
So
but don't use like a lacrosse ball or anything like that.
I don't want you to put a lacrosse ball directly on the spine.
Okay. That's why I didn't do it, because I was like, I wonder if I can do that. Probably give it relief.
Or a foam roller directly on the spine. Definitely do not. Do not do
Okay.
that. That's a great way to get injured.
Really? So, but when you're rolling on the top part, you're rolling on the spine, no?
Yeah, but this
Not
the
down
functionality of the spine is completely different. The rib cage here is essentially a cage, right? So it doesn't allow as much extension. It allows like a little bit more rotation. The lower back does a lot more flexion extension, and when you extend that far back over a lever or a foam roller that's too large, it creates this too much of that extension. And then you have that force going forward from that foam roller that actually hurts the spine.
Okay. All right, so I can roll on the sides, and then I'm going to roll the upper part each side, which is hopefully going to help my bicep as well.
Yeah, and now I'm going to show you